Hello, my name is Adam Riedel. This is my BSN 246 skills video for administering and discontinuing an IV. A few things I need for this: a saline flush, a IV start kit, a primary tube or an extension tubing for this matter. I'm going to use this 20 gauge IV 1-inch catheter for this specific instance, and then I have a start kit which has a tourniquet in it, some Tegaderm, some iodine, alcohol pad, and some tape. I have some gloves as well as my patient, who we're going to pretend that this is their nice forearm. And we're going to kind of pretend that they're like over here the entire time. So first things first, I want to make sure that I actually have an order to administer an IV, in this case I do. We're going to pretend for this instant that this patient has some severe dehydration and that we want to try to get some intravenous fluid in them to help with hydration, which is going to make this a little bit challenging because someone that might be a little bit dehydrated might have trickier veins to find. So I have my order, I have my supplies. I want to make sure that I keep my documentation, my 6 rights of patient administration, patient medication administration, kind of in my mind at the whole time. I'll go into my patient's room, knock on the door, ask them their name and birthday, which they verified and told me the correct one. I'll explain the procedure and why I'm giving them this IV or using the IV, and then ask if they have any questions. So we're going to use this to get some hydration in you. You need to have a little bit more fluid volume going in. This will help with getting you more fluids on top of you actually drinking as well. We'll take it out when it's deemed necessary. It might feel a little bit of a poke or sting when it first goes in, and when I'm injecting the saline, you might almost kind of taste it in your mouth a little bit too. Do you have any questions for me? So say no. So I'm going to use some hand sanitizer before. Well, I'll put my gloves on, and then I'm going to preload my syringe, or preload my tubing with my flush, because Lord knows I've done 3 or 4 practice videos where I forgot that. So we'll get our gloves on, which much appreciate the larger gloves this semester. That's great. It's quite the challenge getting these things on in 225 skills videos. Okay, so I have my gloves on, and then I have my extension tube. A lot of times you would use a primary right away, but I'm going to just use extension tubing here. And we have our saline flush. I'm going to uncap the one side that the flush will go into, and then the other side is where the catheter hub will go in as well. And then I'm actually going to inject a little bit because I want to make sure I don't have any air in this thing. Okay, perfect. Squirted up in the ceiling a little bit, but that's okay. So we're good. So we've got this preloaded, ready to go. I'm going to kind of turn this down a tiny bit so you can like see it better. And sorry that my head is going to be kind of halfway cut off. Tall people problems. That's actually a little better. Okay. So I have my extension tubing ready to go for when I have my catheter inserted, and I kind of have everything kind of right next to me. I have my tourniquet here as well. I'm going to put this on the upper arm 10 to 14 inches above where my site is, but first I actually want to find my site. I want to also ask my patient before anything else if they have any allergies, to which they say no. Since I'm going to be using iodine, I want to make sure that they don't have a shellfish allergy, which can kind of correlate to iodine allergies as well. So I'm looking at my patient's vein. I feel a nice bounding pulse on his median cubital vein here in his forearm without a tourniquet applied, so that kind of is a good indicator for me. I don't feel any valves, nor do I see any tight turns or anything like that, so it's a pretty straight vein, pretty cut and dry, no valves, so it won't hopefully be too difficult. This will be kind of where I want to go. Kind of tell the patient that. So I'm going to put a tourniquet up here. It'll go under their arm, tie it over, and then I'm going to use one end, kind of loop it under like a bunny ear. That way I have a quick release to pull when I'm able to after the venipuncture is over. So out of my start kit, I'm going to use iodine, which I've already verified that they don't have an allergy, and I'm going to start from the center of this and then in a circular motion go outward from my center. Beautiful. And then when I'm doing my insertion, what I'm going to be looking for is what's called a flash, like a flash of blood within my chamber. That will indicate to me as the nurse that I have successfully gotten into the vein, and then I want to make sure that I'm looking for potential phlebitis or the vein blowing after the fact. I want to make sure that I'm not doing that. So what I'll be doing after I take the cap off is I'll be relocating my vein, and then I'm also left-handed, so I'll be kind of doing this with my left hand with the catheter, and then with my right thumb I'm going to be pulling that down towards me, anchoring the vein, and then at a 10 to 15 degree angle I'll be inserting my catheter, performing the venipuncture. So I took my cap off. I'm going to let the patient know that their IV is going to be started, and you might feel a slight stinging. I'm going to pull down with my right thumb, and at 10 to 15 degrees with my bevel up, I'm going to insert my IV till I see I have a nice flash of blood, and I'm going to now advance my catheter a little bit and retract my stylet outside of it. Beautiful. And so I'll undo my tourniquet as well, and I'm holding a little bit of pressure above the vein just slightly. That way I can do that. And then I'm going to secure our connection into the hub here. Okay. And then I'm going to use So I want to make sure that I'm actually aspirating and seeing blood return. That's going to verify to me that I'm actually in the vein, and then if I inject, that I'm not going to be injecting in the extracellular area outside of the vein. So I'm going to pull back on my flush a little bit, and indeed I do see some blood return. So we're going to go ahead and say that we are good to go there. And then I'm going to slowly start injecting into our vein, and when I'm doing this, I'm looking to see if I'm seeing any bumps, any coolness, anything in that regard. I don't see anything happening, and we're about halfway of our syringe here. Do you feel anything, sir? Is it hurting you at all with this injection? They say nothing, and it's looking really healthy and really good. Some people sometimes say that they taste a little bit of a metallic taste in their mouth with certain medications going in, but we're looking really good, and I'm totally just soaking this box right now. Alright, so it looks great. I'm going to ensure that my clamp is on. That way nothing's coming out. And since my syringe is over, we're going to just throw this guy away. We don't need it anymore. We're clamped, so nothing will come out here. And then I want to make sure that this is being secured. Our tegaderm over our site here. Some areas have a really intense start kit with these things called stat locks that will actually lock over the hub and really kind of keeps that in place, and then use what's called foam tape to kind of secure the site. But we're just going to kind of lightly use some of this tape here. Looks nice. Okay, so our IV is in a good secure spot. I would initial the day, the time, and who I am if I was to keep this IV in for an elongated period of time. So I have my one piece of tape kind of directly over it, kind of keeping it taut and flush right there, and then I have my second piece kind of over the tape, making sure that it's staying in the same spot. So I'm going to discontinue my IV now. We're going to pretend some time has passed. I also want to make sure that I verify that my stylet was placed into a sharps container after I used it. My sharps container is just like a half of Mountain Dew can right now. So Just want to make sure that I was still recording. So what I'm going to do now is I'll come back to the room and we'll discontinue the IV. The patient's infusion has been done. Their hydration has gotten a little bit back to a regular balance. So we have an order to discontinue this IV. So I'm going to go ahead and do just that. So I'm going to go into my patient's room, knock on the door, tell them, you know, kind of what the process is and what's happening here. So I'll go in, use my hands hygiene. These are really small gloves. I'm going to see if I can find some not so small ones. And what we're going to do is take that IV out. And I want to make sure I have some gauze, and I like to use alcohol to kind of loosen up the adhesive. What we want to do is tell the patient what's going on. So, sir, I'm going to take your IV out. If you're still here in the hospital, you can take the dressing that I'm going to put on off in about 10 to 15 minutes. If you're still bleeding over your site, put some more pressure over it. I'm going to have this bandage on with a little bit of pressure because I want this to have the ability to clot. If you feel any redness or swelling or burning, you need to let us know. But in all reality, this site should just be a slight bruise for the next couple days due to the fact that you had your vein punctured. Do you have any questions about us discontinuing your IV? They say no. So what we'll do is I'll use a little bit of alcohol, and I'm just going to go around the edges of the adhesive because alcohol kind of acts as an adhesive remover too. So the important thing I want to do is I don't want to be moving this catheter around all over the place when I'm taking this out because it's still in their vein, and that's, even though it's a piece of plastic, it's still going to be a little bit irritating. So what I like to do is I'm going to use one of my hands and kind of just secure that catheter hub right where it's at while I'm taking the tape off, because I'm kind of pulling his skin, which might end up moving things internally, and I don't want to really do that. So I'm pulling this tape off of this patient, the Tegaderm. Tegaderm sucks to take off, people, because it's really sticky. And then I have my gauze here. And above I'm going to keep it above my tourniquet. I'm going to kind of put it on top. And then, are you ready, sir? They say yes. And we're going to pull our catheter out. And what I'm looking for is the intactness of this catheter. If this is not intact, that's a major league problem, and you need to notify the healthcare provider immediately. This should be intact. It's okay if it's bent a little bit, but it has to be intact in order for you to successfully discontinue that IV. In this case, it indeed is, so we're going to throw that away. That's not a sharp, so it doesn't have to go into a sharps container. And I'm holding some pressure on that site for ideally 30 seconds. And then I'm going to use a little bit of tape, even though I'm stuck to a bunch of tape right now. And just tape over that site if I can, if it's just not so stuck to me. Oh my goodness. So, over that site. Beautiful. And that is how you start and discontinue an IV. Thank you very much.